Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Urinary tract infections in elderly adults. Introduction. A urinary tract infection, or UTI, is an infection of the urinary tract. A urinary tract infection, or UTI, happens when the urinary tract becomes infected, usually by bacteria. UTIs can affect people of any age, but symptoms may differ between young adults and the elderly. This program explains the causes, symptoms, and treatment options for urinary tract infections in the elderly. Anatomy. The urinary tract is the body's drainage system for removing waste and extra water. The urinary tract usually includes 2 kidneys, 2 ureters, a bladder, and a urethra. The kidneys are a pair of organs that are each about the size of a fist. They are located below the ribs, one on each side of the spine, towards the middle of the back. Urine travels from the kidneys down 2 narrow tubes called the ureters. The urine is then stored in a balloon-like organ called the bladder. It is emptied through the urethra, which is a tube at the bottom of the bladder. Urinary tract infection. A urinary tract infection, or UTI, happens when the urinary tract becomes infected, usually by bacteria. Bacteria normally cannot invade the urinary tract because the body destroys them and flushes them out. When the body's defenses are not strong enough to remove the bacteria, a UTI results. Women are more likely to develop UTIs than men. This is because the urethra is shorter in women, so bacteria don't have to travel as far to reach the bladder. In addition, the urethral opening is close to the anus and vagina, so bacteria can move from those areas to the urethra. More than 50% of women develop at least one episode of UTI at some point in their lives. UTIs don't happen as often in men, but UTIs in men may indicate a more serious problem, such as a sexually transmitted infection. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Symptoms. Symptoms of a UTI depend on age and other factors, but even men or women within the same age group having the same UTI may experience different symptoms. Common symptoms of a UTI include cloudy urine, urine that is off color or dark. This may mean there is blood in your urine. Strong-smelling urine. Young women usually feel an urge to urinate and pain or a burning feeling while urinating. They may go to the bathroom often but not pass much urine. Since the immune system changes as a person ages, the symptoms of a UTI can be different for elderly people. Older adults with a UTI may not experience any physical symptoms. Instead, they may only experience sudden behavioral changes called delirium. Symptoms of delirium include agitation, confusion, hallucinations, delusions. If an elderly person is difficult to wake up, seek immediate medical help. Sometimes the mental and behavioral symptoms of a UTI are mistaken for dementia. Dementia is a long-term illness that progresses slowly. Unlike dementia, the symptoms of a UTI come on suddenly, within a matter of days. In patients who have been diagnosed with dementia, a rapid decline can indicate a UTI. Elderly people with UTIs may become withdrawn and try to avoid contact with other people. They may develop suddenly worse motor skills, loss of coordination, or dizziness. They are also more likely to fall. Urinary incontinence can also be a sign of a UTI in the elderly. Urinary incontinence is a loss of bladder control that leads to the leakage of urine. A UTI limited to the bladder does not cause fever, but it can cause fever if it involves the prostate or spreads to the kidneys. If an elderly patient has a fever, they need immediate medical care. Someone who has a catheter and develops a UTI may have fever without any other symptoms. Other than fever, symptoms of a kidney infection may include nausea, vomiting, and back or side pain. People with symptoms of a UTI should visit their healthcare provider right away. Causes. Most urinary tract infections are caused by one type of bacteria, E. coli, which normally lives in the bowel. Sexually active people have a higher risk of getting UTIs. During sex, germs from the anal and genital area can come into contact with the urethra and cause an infection. As people age, the muscles of the bladder and pelvic floor become weaker, so elderly people have a harder time emptying their bladders completely. This means that urine can stay inside the bladder longer, and bacteria can build up and cause an infection. Urinary and bowel incontinence are also risk factors for UTIs in the elderly. People that wear adult briefs for incontinence are more prone to infections because briefs keep urine and feces in contact with the skin. Bacteria from feces, or stool, can travel to the urethra and cause an infection. Elderly women are at a higher risk of getting UTIs than elderly men. After menopause, women produce less estrogen. This makes UTIs more likely to happen because the vagina is less able to get rid of germs. Germs from the vagina can travel to the urinary tract, causing an infection. Chlamydia and gonorrhea are other types of bacteria that cause sexually transmitted infections, or STIs. These bacteria can cause UTIs that affect the urethra. Men with a UTI in the urethra may need to be tested for STIs. UTIs in men can also be caused by kidney stones and an enlarged prostate. UTIs in men are often more serious than UTIs in women. They can be life-threatening if not treated right away. A UTI can also be caused by a catheter. A catheter is a tube placed in the bladder through the urethra to help empty the bladder. It is typically placed in a healthcare facility, but some patients are sent home with a catheter. Diagnosis. Your healthcare provider will ask about your symptoms and medical history. He or she may test a sample of urine for bacteria, red blood cells, and white blood cells. Red blood cells mean there may be blood in your urine. White blood cells fight infection in the body and may indicate a UTI. Your healthcare provider may request a clean cat's urine sample to see if there are bacteria in the urine. This involves wiping the genitals to remove most of the bacteria from that area and then urinating into a clean container. This method helps prevent bacteria on your skin from getting into the urine sample and giving inaccurate results. The urine sample may be sent out to a lab for testing, or it may be done at the healthcare facility. Some patients may need to wait a few days to see if bacteria grow in the sample. People with UTIs that happen repeatedly may need additional testing to see if the urinary tract is normal. Treatment. UTIs are usually treated with antibiotics. You may start feeling better within a day or two. Even if you start feeling better, don't stop taking the antibiotic. Take the full course until you run out. Not taking the antibiotic as prescribed makes the bacteria harder to kill. This can make future UTIs hard to treat. Severe kidney infections may require several weeks of antibiotic treatment or a stay in a healthcare facility. Kidney infections in adults do not usually lead to permanent damage as long as they are treated early. Drink lots of water to help speed recovery. Avoid drinks that contain citrus juice, alcohol, carbonation, like soda pop, or caffeine. These can make your symptoms worse. Using pain medication or a heating pad can help ease your discomfort. If you have UTIs often, your healthcare provider may recommend taking an antibiotic more regularly. He or she may recommend taking a single dose after sex, 2 to 3 days worth whenever you have symptoms, a course that lasts 6 months or longer. Preventing urinary tract infections. Urinating often helps flush bacteria from the urinary tract. Bacteria can grow in the bladder if it stays there too long. Drinking lots of water every day can help prevent infections. If you have kidney failure, talk with your healthcare provider about how much fluid you can drink. Urinating after sex helps flush out bacteria that went into the urethra during sex. Drink a full glass of water after sex. Unlubricated condoms, diaphragms, and spermicide can irritate the vagina and encourage bacterial growth in women. The bacteria can then spread to the urethra and bladder. Women should use lubricated condoms or a non-spermicidal lubricant during sex. Women should wipe from front to back after going to the bathroom, from the vaginal area towards the anus. They should also not use the same toilet paper that has touched the anal area to wipe the vaginal area again. This can help prevent bacteria from entering the urethra. People who wear adult briefs or other products for incontinence should have the brief changed promptly after each bowel movement and after urinating. They should also clean the genital and anal area each time the brief is changed. Caregivers may want to set a timer or set up reminders to encourage elderly patients to go to the bathroom instead of using adult briefs if possible. Wear cotton underwear and loose clothing. Tight clothes and nylon underwear can trap moisture and allow bacteria to grow. Douching or using other feminine hygiene products such as deodorant sprays can raise your risk for getting a UTI. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. A urinary tract infection, or UTI, happens when the urinary tract becomes infected, usually by bacteria. Most urinary tract infections are caused by one type of bacteria, E. coli, which normally lives in the bowel. Common symptoms of a UTI include cloudy urine, urine that is off color or dark. This may mean there is blood in your urine. Strong smelling urine. Older adults with a UTI may not experience any physical symptoms. Instead, they may only experience sudden behavioral changes called delirium. Symptoms of delirium include agitation, confusion, hallucinations, delusions. Sometimes the mental and behavioral symptoms of a UTI are mistaken for dementia. Dementia is a long-term illness that progresses slowly. Unlike dementia, the symptoms of a UTI come on suddenly within a matter of days. In patients who have been diagnosed with dementia, a rapid decline can indicate a UTI. The infection may spread to the kidneys and prostate and become more severe. Fever may indicate a kidney or prostate infection. Urinating often helps flush bacteria from the urinary tract. Bacteria can grow in the bladder if it stays there too long. Drinking lots of water every day can help prevent infections. If you think you have a UTI, it is important to see your healthcare provider. Your healthcare provider can tell if you have a UTI by testing a sample of your urine. Treatment with medicines to kill the infection will make it better, often in 1 or 2 days. Thank you for using Explain.